This government meeting is brought to you by Eastworks and our local cable subscribers.
I'll make a motion to start the Board of Health meeting at 5:34 p.m. on December 10th.
Second that motion.
All in favor, Steve, yes.
Sam, yes.
Sam, I wasn't sure if you mind going through the agenda, and you're just going to read the opening remarks. That's okay.
Sure.
Okay. You go ahead and read the opening remarks, please.
In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email to the health@easthamptonma.gov email.
Thank you very much. Ryan, can you just run the admin for any public speakers that we have here?
You got it. So far, we have one person who has raised their hand to public speak. Stephen, if you'd like to go ahead, you have 3 minutes.
Thank you. My name is Stephen Helfer, and I am speaking on the tobacco and nicotine product, the generational prohibition. And I realize that there is a lot of pressure from many sources, both at the town and city level and at the state level, to pass this. And that is why, as a citizen of Cambridge, I am speaking against it. First thing I'd like to mention is that if the tobacco industry is trying to attract youth, it is not succeeding. Last October, the Centers for Disease Control and Prevention reported that teenage smoking rate is at a 25-year low. That is as low as it's ever been since they've been keeping the statistics. In September of last year, the Food and Drug Administration reported that teen vaping is at a 10-year low, and their use of nicotine pouches is also low. These are on their websites, available for all to see. Immigrants of color happen to own most of the stores that sell nicotine and tobacco products. And while it has been pointed out that such a prohibition may not close their stores, it will definitely hurt their businesses and reduce the overall value of their stores. In the Brookline News, Elias Aubrey and Fahid Iqbal have reported that since this ban went into effect in the town of Brookline, their overall sales have declined, including gasoline, not just on nicotine and tobacco products, as people don't come to their stores as often and buy a variety of things. Right now, mass residents over the 21 and over are deemed competent to purchase marijuana and alcohol, both of which are intoxicants. I believe they are also competent to make their own decisions regarding tobacco and nicotine, neither of which impairs judgment or compromises driving ability. Thank
30
you.
seconds, Stephen. Thank you.
Thank you.
Thank you, Stephen. Is
Thank
there
you.
anyone else?
Oh, sorry. One more person. Jonathan, you're good to go if you'd like. You have 3 minutes.
Hey, sorry about that.
That's all right.
Yeah, sorry. Bad lighting in my condo right now. Anyway, yeah, well, anyway, my name is Jonathan. I volunteer with Steven, and we do, we try to advocate for the rights of smokers and, a good, well organized organization. And, I'm definitely a smoker myself. I love to smoke. I do some statewide mental health advocacy, and I've been really into peer support and so forth. But I mean, there's nothing more helpful for people who are openly in recovery, than having a nice real black coffee and a tobacco cigarette. And it gives people something to look forward to. It helps pay attention. It cuts anxiety and overeating so much that it's a better decision to smoke. I have a lot of mental health from smoking, and I don't see any of the other side of the story. And I mean, I don't drink to excess, but if I had been a person in prohibition of alcohol, I would have been very upset. And I mean, so I think that, if you say like, we'll allow you to smoke, but please go outdoors, or there's a nice smoking area where you can be defended from the weather, that I would find to be good enough. I mean, even if people are institutionalized, if they put a giant fence around a nice outdoor smoking area, it would probably go over very well. But I mean, it's ridiculous. Like, if in like 10 years we're barring like 30 or 35-year-olds from purchasing tobacco, I think that's completely unfair. People have always counted on cigarette breaks to do better at work. So I don't know. I mean, I'm not a big fan of nicotine-free generation, and I think they shouldn't bully honest people who smoke. So, but thank you. I appreciate being able to speak.
Thank you, Jonathan. And that is everyone for public speak.
Okay.
Great, thanks so much.
Thanks.
All right.
Sam, I don't know if you want to just work your way down the agenda.
Yep.
If you don't mind, please.
The
Thank you.
next item on the agenda is to approve the meeting minutes from November 12th, last month.
Um, I reviewed them. I didn't have anything to add or take away. What about yourself?
I wasn't present at that meeting, so I'll have to abstain from approving them.
Okay. That's right. I forgot you weren't there. You got called into work.
Yeah, it's a bummer.
Yeah, it happens, right?
Yeah.
I would like to make a motion to table the approval of the minutes until Beth is at our next meeting.
That makes sense to me. Do you need my agreement for that if I'm not voting on it?
Yeah, you'll just have to second it.
Sure. Sam seconds that.
All in favor, Steve, yes.
Sam, yes. All right. So we'll table that till next month. Next on the agenda is Ryan, Director of Public Health update.
Thanks, Sam. Just a quick update. All of our inspections are currently up to date. The only housing concern that is, last week we had one emergency condemnation, and that was over 7 days ago. We didn't get any requests for a hearing, so that house has been placarded. As far as 2026 permits renewals are going, they're going good. We have about 85% of everyone's completed applications so far. And we will reach out to anyone who's still outstanding and just remind them that if we don't receive their permit renewal by December 15th, there's going to be a late charge EARSA has been doing excellent on staying up to date on that and just ensuring we're getting all our 2026 applications in. A quick hiring update. I met with Mayor Derby last week and just reviewed the need for a public health nurse and then an outreach worker. He's on board with it. We're going to meet again and just see where the budget stands after the hiring freeze is over, the second week of January. But I really expressed the real need for a outreach worker. Currently, we don't have an outreach worker, and myself and our inspectors and the clerk have all taken on that role and tried to fill it as best as we can. But just having an outreach worker would be very beneficial. We discussed potentially changing the role. In the past, we've had a social worker, but we've discussed changing it to more of an outreach type worker that would assist residents with resources and referrals and assist them with obtaining services, similar to what the Council on Aging has in place. I sent you guys a draft job description outline. If you want to take a look and just any suggestions or concerns or comments you may have. As far as vaccinations, homebound vaccinations are still being provided by appointment. Homebound flu and COVID vaccinations are through the shared services. So you can go to the Northampton website and then you can register online. And if anyone's unable to register online or can't find it, you are more than welcome to call the Easthampton Health Department at 529-1430, and we will assist you in registering for any homebound vaccinations. We still have masks if anyone needs them, and we have a limited supply of COVID tests. There's a good chance we won't get any more COVID tests in the near future, so we're limiting to just one COVID test per household while they last. As far as the infectious disease report for the month of November, it was just 5 or less reported confirmed flu cases, and then 5 or less confirmed COVID cases. And then as far as housing court, 21 Love Fields, is still in court. That was extended for 30 days just while we do tax title research. It's a little confusing in regards to who the actual owners of the property are, but it's still something that is on our radar. And then I spoke with the city treasurer, and the property is also in tax title court for outstanding taxes. So at that request of the treasurer, I submitted a letter from the health department just outlining the health concerns of the property to hopefully expedite that process. And then apart from that, just some winter food events coming up. We've had the farmers market every week. It's been a bit challenging in regards to ensuring everyone has their correct food permit, but we've been doing a good job of that. And then there's a pop-up market coming up this weekend at Eastworks if anyone is looking for some Christmas presents. But as far as me, that is all I got.
All right, thanks for the update.
Sam, do you have any comments or anything?
I don't think so. That's helpful to hear. It'll be interesting to see what, the budget looks like come next year in terms of hiring for those positions.
Yeah, Ryan, I was just wondering if you could maybe get the mayor maybe at the next meeting, just kind of see what his goals are and what he's looking to see from the health department.
Yeah, I'll request it.
And then regarding upfields, is there anything the Board of Health can do to at least get rid of some of the junk in the front of the house?
I'll look into it. Apart from court, I'm not too sure. Or if the city was able to take the property over, then it would be the city's responsibility to immediately abate all the junk in the front yard.
Okay. Regarding the masks you guys have left over, what kind of masks are they? Are they just like surgical masks?
They're the KN95 masks.
Okay, great. That's all I have so far. Thank you.
All right, next up, I think is Kelsey for health inspector update.
Yep. Good evening, guys. So kind of to touch off of Ryan for the events, we have the farmers market and all the little pop-ups happening this weekend. Going a little bit more in depth on the farmers market. As Ryan said, it has been a bit challenging. We've been going, and we found that people are selling food that are not permitted. So at this point, Ryan and I, kind of going every single weekend to make sure that people have their permits and that they're filling out their applications. I was just there last weekend and I stumbled upon one person that had an application filled out, but I think they were hoping that I wouldn't come so that they wouldn't have to, pay their fine. So again, we're just staying on top of that, making sure that we're there for the weekend. And that is until March 22nd. And then
Is it every?
Go ahead.
Is it every weekend or every other? Sorry,
It's every Sunday. Yep.
Sunday. Okay.
Yep. And then for food establishment inspections, we have 19 establishments on the 3-month tracker. Of concern, we have Old Colony Package Store and Sevens Sports Bar and Grill, as well as Corsello's Butcheria. The owner of both Old Colony and Sevens, I believe Naresh Patel is here tonight, so we'll go kind of more into depth once his hearing happens at that time. I don't believe Vincent is here, so I will kind of just touch on what's been going on there. He had a routine inspection October 30th, and food-wise was good, except he has he's doing reduced oxygen packaging, and he doesn't have a HACCP plan for it. I mean, the one he provided me with wasn't detailed, didn't go into the process. So we had him apply for a variance. And I'd sent an email November 4th telling him everything that he needs. That, and then it was a grease trap servicing was required. So I emailed him on November 4th about everything. Those two things. I didn't get a response, so I emailed him again November 17th. Didn't hear from him again. I called him November 20th. He picked up, we spoke about it, and he agreed. And I said, listen, we need to get this done. Call me back if you have any questions. Additionally, I emailed him again on the 25th of November, and he responded the 28th. He gave me his HACCP plan, but like I said, it's just not going into depth. It's not touching what we need. He didn't provide temperature logs and stuff like that. And his variance this whole time has not been submitted. I linked the variance application PDF each email. And again, the grease trap still not serviced. December 1st, I sent him an email with a deadline of December 4th for, again, the HACCP plan, the variance application, the grease trap documentation. I also attached a cease and desist date for his roping machine for the reduced oxygen packaging machine, and got nothing back from that. And then the 9th, so the other day, yesterday, I emailed him with an invoice and cease and desist, again, as a reminder, also requiring him that he needs to be here tonight. So, yep. And then we also issued him an invoice for $100 for the uncorrected grease trap violation. And we stated that if he is continuing not to be in compliance, he gets a $100 weekly fee. So yeah, that's where we're at right now. He's supposed to be here tonight. So that's the big one, of course, Corsello's. Like I said, we'll touch more on Old Colony, and Sevens has been good. I went this evening right before I came here. Looks like everything has been fixed besides the flooring, which I actually spoke with Naresh today, sent him pictures of what needs to be addressed specifically. the flooring is kind of is in disrepair and such like that. And so he's had 3 re-inspections for Old Colony, and then 3 for Sevens as well. An invoice was issued for Sevens and it was paid, and for non-compliance. So those are the 3 main ones of concern. I put Glendale Grill. He came in, spoke with us, fixed what he needed to fix. So that went great. We're on good terms with him, but we are keeping him on the 3-month tracker. For housing, it's the least. Last month was the most we'd had. Specifically 531 East Street, significant amount of miscellaneous items, trash. I spoke with the owner the other day. He's working with me to get everything cleaned up by the 30th of December. Lot 37, the one with all the cars and stuff like that. We're working with the owner. Ryan and we met him, and he's willing to work with us. I have seen a little improvement, definitely better than it was initially. And we spoke with him and said that his trailer, the RV, we gave him a cease and desist that it cannot be there, and it should be removed by the 15th. So we have a reinspection next Monday for that to make sure it's off the property. But yeah, that's kind of a rundown of everything of last meeting and December.
Kelsey, just to clarify, the one that you went into detail about at the very beginning, was that for Corsello or which? Okay, that's what I thought. I was like, wow, the dates are matching perfectly, but then we'll come back to it more later. So I just double checking. Thank you.
Yeah, he's not here. It doesn't appear that he's here. So I want to go more in depth since we're going to be talking about Old Colony later.
Okay, thank you.
What was happening at Glendale Grill?
We found there were several violations. There was thawing methods. There was food uncovered, or a lot of contamination risks. Cleanliness was not great. Food on the floor, misuse of wiping towels. Kind of, it was a laundry list. I mean, I can also send you the inspection reports that we have more in depth. But
yeah, that'd be great.
Yeah, of course. But yeah, he came in. We gave him a correction action plan. So he has to kind of address each violation, what he's going to do, the status of it, and so on and so forth. So he's been complying with us, which has been great. And
Sevens, it's the floor you said, or?
Yep, the flooring. And it was the last one, the last inspection too that I was at, not this today, but the 20th. There was open pack of cigarettes on the food prep table. So right where the food's being served. So that was a big one. So I wanted to go again for sure to make sure, we're not having any tobacco near any food whatsoever.
Sure. Yeah. Good practice.
Yep.
All right. Regarding Corsello and Old Colony, we can wait for the next item. Thank you.
Thank you.
Okay, well, the next item on the agenda are the variance requests. So the first one is go with the float.
So real quick, go with the flow. Just looking, one, if the Board of Health has any concerns, and 2, I know Sam, I know you requested to abstain from this vote, but I would just need 2 board members to sign off on it if they approve the variance. Reviewing it myself, I think that the proposed variance meets, if not exceeds, the same public safety expectations that they're requesting. And I don't have a concern with the variance.
I don't know, then it should be tabled till the next meeting when Beth is here.
I mean, I'm comfortable with it. I don't know if you had a chance to look at it more. And Ryan, we can call on the lab data whenever we want, right?
Mm-hmm.
For review. Okay.
Correct, and they'll have it present at the establishment.
Yeah. I can vote if you're comfortable, Sam. If not, we can table it.
Yeah, I wasn't at that meeting, so I didn't get to hear from them.
Okay.
I will be abstaining.
So I will, okay. So I will make a motion to table the variance for go with the float for January 2026.
Sam seconds.
All in favor, Steve, yes?
Sam, yes.
Great.
Then the next variance is for Corsellos.
And I'll let Kelsey go into this one again. But the brief synopsis is they're doing reduced oxygen packaging to extend the shelf stability of some of their items. They need a variance for it because it's considered a specialized food process. They've been doing it for some time. We found out about it recently. Kelsey's been working with them to get the variance application submitted, as well as the HACCP plan. The HACCP plan submitted wasn't where it needs to be for me to approve it to send it to the board. But we've had a difficult time working with them. And Kelsey, if you have anything to add, feel free.
Nothing with that. Nothing with the variance and cut dry. It's just he's not filling it out to what he needs to make it approved by the board. Grease trap. In the beginning too, I sent him companies that around here commonly use for him to do. So I've given him resources and still not no response with that. The response that he did give was kind of like I have it here. This 28th. He just stated that he does his own grease trap, which we've been having with other establishments. They just are like, I can do it myself. But the problem is we want to make sure that they're disposing of the FOGs properly, fats, oils, and grease, so that there's no environmental hazard. So that's why we push, and it is a local ordinance that we have them clean the grease trap, have a professional clean it at minimum every 3 months. And it looks like when I was there, he's doing it himself. And I'm like, okay, where are you dumping it? He's dumping it out back. So that's a huge hazard. That's why we are pushing and really want everybody, but obviously him in this instance, to be serviced professionally with that. Yeah, that's pretty in depth of what we got. We're not getting any response pretty much at all. So
Kelsey, when you say he's dumping it out back, it's going like in the parking lot, or is it going into a sewer directly?
Yeah, I don't want to assume, but when he said out back, it is kind of a parking lot. I don't know if there is a sewer drain back there. That's something I can definitely look into again. I think at this point too, Ryan and I are just going to have to go there and really talk to him about everything and really get down to it at this point. So I'm not sure, but I'm assuming it's probably in a drain in the back parking lot.
Okay.
Mm-hmm.
One other question I had, if you know, what is this packaging being used for? I've been there. I've bought some meat from there. I'm just curious, to what extent is this type of packaging used on their products? Is it?
Yeah. So basically, like when, for you're buying ground beef, he puts it through the reduced oxygen packaging, and it suctions. It's a vacuum suction, so it is able to preserve the meat, which is why it's required a variance, just so we know that it's safe and that the process isn't going to have any bacterial growth or anything like that. So people need variances too for like smoking meat, sushi rice.
Yeah,
things
Biggie's does it.
Yep, they do, and they have a beautiful HACCP plan. So yeah, for things like that to preserve meat or food.
Okay. So it's commonly done for meat at other locations. It's just that they don't have the plan detailed in place and the variance approved. Okay.
Correct. Yep.
So just where we stand currently is we issued a cease and desist effective tomorrow. for the reduced oxygen packaging. And we started weekly fines until we get confirmation that the grease trap is being serviced by a licensed septic hauler.
Okay.
I don't know if the board has any concerns or any recommendations.
Yeah. How long, Ryan? I know you weren't here, but do you remember how long Big E's was using theirs before they submitted the variance? I know it's some time.
No, I don't off the top of my head.
Yeah, I know it was. I think it was over a year at least, and then
Yeah,
I know they had the trouble filling out the logs when you went in there as well.
and Costello's in a similar boat. They've been doing it for
Sure.
quite some time as well. And I'd be glad to, I emailed him, requested that I was available Thursday or Monday. I would love for him just to stop by the health department, sit down with me for an hour, and we can go over the variance request for him, and I can assist them with doing a HACCP plan where that would meet the requirements.
Sure. I myself I was also eating there a number of times and got in the vacuum, and I've never been ill from it, so that's a good start. I would be in favor of giving him a little bit more time and not taking such an aggressive stance. I'm not sure how Sam feels about that, but the grease trap has to be taken care of. At least the reduced oxygen packaging.
Yeah, I mean, I think it's a little hard because you're not getting any real response back. And you want to show, that like it's a serious thing and there are compliance things. So I would also like to give them the benefit of the doubt, but it would be helpful, I think, to have some kind of response like, hey, yes, I can come in 5 days or something like that.
I'd be comfortable with that if you're in favor of holding off the cease and desist until after the next Board of Health meeting, assuming that Mr. Corsello comes in and works with us on getting a variance request application and approved HACCP plan.
Yeah, I mean, I think that's okay, but I think I would want to know that they're responding before then. Like if you don't hear anything and then we're just back at this stage next month. I don't know.
I'm prepared to make a motion, and if you agree, you can second it. If not, we can keep going back and forth.
What's what I guess what are you proposing then in terms of timeline?
Sure. I mean, I would, I'd want him to come into the health department at least in the next 5 business days.
Mm-hmm.
And maybe suspend the cease and desist for 30 days. That'll give him some time. And Ryan, does the health department have like a list of consultants to help with this stuff? I know Big E's had worked with a consulting group as well.
I could provide him with a list of consultants in the area, yeah. But I'd be glad to work with them, and I could even use Big E's as a reference, and I'm sure we could get a acceptable HACCP plan together.
Sure.
Yeah, I mean, I
Sam,
think that's a good idea. Give them, another week or two if they're able to come in, and then yes, you could suspend it till the next meeting then.
So I will make a motion to suspend the cease and desist order for the reduced oxygen packaging for 30 days as of today, December 10th, in the condition that the owner of Corsello will meet with the Easthampton Health Department in the next 5 business days. The deadline is the 17th of December, 2025.
Sam seconds that motion.
All in favor, Steve, yes?
Sam, yes.
Awesome.
All right. I think that's it for the variances.
That's it for the variances.
All right.
Okay.
So then next up is the hearing for Old Colony.
I'll make a motion to start the hearing for Old Colony non-compliance.
I second that motion.
All in favor, Steve, yes.
Sam, yes.
So I'll just start off real quick, and Mr. Patel is here as well. This first came in front of the Board of Health back in February of 2023. The walk-in coolers in Old Colony, both walk-in coolers are made out of wood. So they're very porous. It's a damp area, so there's a lot of mold in there. And then wood's not an approved material for a walk-in cooler. So that's the main issue we have with Old Colony. But like I just want to say, Mr. Patel has been working with us. There was a bathroom that was an issue, and he removed that to come in compliance. But the biggest thing is the walk-in coolers, and we need them to have some type of material that is not porous and is easily cleanable.
Do we want to let, you said he's here, Mr. Patel?
Yes.
Yes, I'm here. Give me a second.
Okay.
Let me park my vehicle somewhere I'm driving, but I will give me a 20 seconds and I will park my vehicle and I can discuss.
I'm good.
That's fine.
But yeah, no, I just want to say that this was an issue back in 2023 with the previous owner as well. Just building a walk-in cooler out of wood.
Okay, so that's issue. I don't know that. I mean, it's kind of the like a previous owner never told me about this. This is the issue, and he's sneaking. So I didn't know anything about until you guys comes and said something like he have already these things going on. But that's a Gold family. Eddie and Eddie's son-in-law, who is working that time, and no one told us about anything. So that's a different story. But my kind of saying like this cooler is maybe God knows it's maybe done before most of here in a meeting. They maybe cooler built before that, before even we born. Cooler might be built even 50, 60 years ago. And we just selling the beer and wine from that cooler. Maybe not even wine, maybe only beer. So I don't know. The cleaning issue, I can do it right away. And I can keep eye on it every month or every other month, and we might be keep the log. We are cleaning, and maybe you guys stop by quick every other month, every 3 months to look at how it's looking. I don't mind to doing that things, but the whole 100% cooler is built out from the wood. To take it out, everything, and put something new or put the layer on it, I don't know, we might be just patching. So if he really need to be done, I can done it, but this is not what I really want to do it. Kind of like saying, I will work with you guys, but the cooler is made out from the wood. And I don't know, you guys know more about anything else, but there is a used to be Smithy Packet store. Same situation, maybe like 25 years ago. I don't know who remember the Smithy Packet store next to the Big Y or next to the Walgreen right now. They have a same situation. And as soon as I buy, the health officer came. I don't know, that time they don't have even a health officer, but somebody came from the Southampton and said like, well, this cooler is not right way to build. I said, well, previous owner have this business for 40 years and nobody said nothing to the previous owner. As soon as the new owner comes and say like, wow, that's not compliance. So I don't mind to work with you guys, but it's really, really hard to cover the entire cooler with the different material. Most of the part might be easy to be covered with that material, maybe ceiling and a back wall, but there is a small pieces around the cooler door where you open the door. They have like the whole rack system in the back. So putting that some different kind of the material, you have to be take it out the every single rack system. And I feel like it's not worth it. I might be, if you guys pushing, then I might be close that location and I will move my liquor license somewhere else.
So
Is that all you have, Mr. Patel?
sorry.
Are you done speaking, sir?
What is it? I'm all set. No, you guys.
Are you done?
I'm done.
Okay. Ryan, did you have anything else to?
Yeah, that's just where we stand right now, and I understand where Mr. Patel's coming from. Per the food code, it's pretty cut and dry that walk-in coolers
Yep.
have to be easily cleanable, non-absorbent. I understand it's a beer cooler and they're not doing any food preparation, but the way Easthampton has it listed is a food establishment and alcohol is considered a food. So that's where we are, and not sure what the board would like to do.
Tim, I'd like to keep this going next month with Beth, if that's okay with you.
Yep, that's fine.
And Ryan, I don't know, can you send me that part of the code? And any kind of material people are using to cover the wood too? Some kind of probably high density plastic or something.
Will do.
Yeah, I guess that was
Okay.
my question is, so there is an option for lining it essentially with a different material that's more easily cleaned.
Correct. As long as they line it with a non-porous, smooth, easily cleanable material, any stick-on material, anything like that, any type of laminate, it would be in compliance.
Okay.
Great. I'm going to make a motion to close the hearing, as well as put it on the agenda for January 2026.
Sounds good. Sam, second that motion.
All in favor, Steve, yes.
Sam, yes. All right. So let's see. We're almost there. Item 7, Board of Health Regulations review / discussion.
So just a couple quick regulation updates. The first thing I want to put in front of the board is update to our tobacco regulations. And I just want to thank Board of Health member from Belchertown, Ken, for being here. And Ken, if you wouldn't mind speaking just on Belchertown, what Belchertown Board of Health has done in regards to being one of the first towns in our area for implementing new tobacco regulations, the nicotine-free generation regulations, and just answer any questions that our board may have.
I guess my mic is on. Hi. Okay. Thank you, Ryan, Steve, Sam, for inviting me. I'm Ken Elstein, a member of the Belchertown Board of Health. And I think it's really good for Board of Health members, particularly here in the Pioneer Valley, to communicate with each other, because we have, while every community is different, we have a lot of similar problems, and so it's important to speak together. I want to start with a personal note, if I may. My grandfather died at the age of 49 of cancer. And as terrible as that was, it had a profound effect on my grandmother, his widow, and my mother, who was age 12 at the time, because they had spent their entire life savings trying to treat him. And he never met me, I never met him, but the effect on other people was really profound. And we Board of Health members, we talk about budgets, we talk about regulations, we talk about individual cases, but it all comes down to what happens to the people that we affect. And I always try to keep that in mind myself. Nicotine-free generation is a kind of a follow-up to the efforts by Massachusetts to increase the tobacco age from 18 to 21. Under nicotine-free generation, instead of having a specific age that the vendors, merchants have to calculate how old is this person, it's based on a birth date, a year. And the merchants in Belchtown have told us it's actually easier. So for example, in Belchtown, we passed this exactly a year ago, last December, effective January 1st of 2025. We set a birthday cutoff of January 1st, 2004. So what it meant was that nobody who was at the time legally eligible to be sold any nicotine product would continue to not be able to do that. But perhaps more important, and a response to the industry and the merchants, is that it does not affect anybody who is already a legal purchaser. So in particular, the businesses do not lose any current customers. I know there was a previous comment earlier today that people have lost business, but they haven't lost any customers under nicotine-free generation in Brookline or any of the other communities. 21 communities in Massachusetts have passed it so far. And there are public hearings and the like scheduled in many other places, votes probably before the end of the month. The big news around here is that Leverett and Amherst, in that order last week, passed it, bringing the total number of people in Massachusetts who live in nicotine-free communities to over 627,000. And of course, in the case of Amherst with UMass and the other two colleges, it means that most of the 26,000 undergraduates in those three colleges will not be exposed, or at least legally be sold nicotine products. This is very different from the situation, let's say, in the 1920s and 1930s with alcohol, in which it was illegal to possess it as well as to sell it. And we're not saying in nicotine-free generation, there are no prohibitions on people having it. Why would we do this? I'm going to quote a rather strange entity to explain it in one sentence. In Thanksgiving, we went to Connecticut, and several of the convenience stores in Connecticut have a sign hanging on the window, and it says, quote, "A primary way youth get access to tobacco products from consumers is from consumers of legal age," close quote. That is from Philip Morris USA. Philip Morris USA is saying that young people get their tobacco and other nicotine products from legal purchases. And what this does is it increases the legal age and therefore increases the gap between those who are legally sold it and those who can receive it. Now, 21-year-olds have friends and go to parties and the like with 20 and 19 and younger people, but 26-year-olds don't. And in 5 years, 26-year-olds would also be included in this group. So it very, very slowly, without affecting any current tobacco user, it very slowly increases the age. We did it in last December. This is now 12 months that it's been in effect. I have not heard any negative feedback yet as a member of the Board of Health. I mean, there may have been some people complaining, but we haven't heard it. So it certainly hasn't been an upwell of opposition. Let me point out, in the case of Brookline, which did this, I guess about 5 years ago, They were challenged by the nicotine industry, big tobacco, in court. The Supreme Judicial Court wrote a something like 80-page opinion in which they knocked down every single objection from the industry and unanimously agreed that Brookline, and therefore any other community, could go ahead and set this kind of addition to their tobacco regulations. People in the opposed to this talk about freedom, but the word addiction is the complete opposite of freedom. If you're addicted, I mean, people addicted to drugs, other drugs, they go out and commit crimes. Some of them commit murder. This is not normal behavior, and that is not because they have free choice. They don't have free choice. And many nicotine addicts tell us that it's harder to give up nicotine addiction than it is to give up, say, heroin. The vast majority of people who start nicotine use started as teens, 14-year-olds, 16-year-olds. We know that in middle schools, there are kids vaping, and vaping is now the big thing. There's a question of what I call leakage. Okay, can somebody say a 16-year-old who would be prohibited in Easthampton from buying, or let's say a 21-year-old, from buying nicotine to go to another town? And that'll happen to some extent. The experience, though, when, and the one good academic study, which was done in relating the first town in Massachusetts to raise the age from 18 to 21, is that it cut youth tobacco use by about 50%. So yeah, there was some leakage, but it had a real effect. And going back to my grandfather, you're going to save lives if you vote for this and consider it at a future meeting. I should mention that there's practically a zero chance that big tobacco is going to challenge this again after having lost so profoundly in the Supreme Judicial Court. But we do have, all of our towns have a guarantee, a promise from a professor at Northeastern University, the one who successfully brought the case for the Supreme Judicial Court, that if any of us have any legal difficulty with respect to this, that he and his colleagues will defend this pro bono. Let me say one other thing, because we're committed to doing what's best for the health, but we all live in a world in which many of our neighbors and our friends try to look at everything through a partisan lens. Restricting dangerous drugs is not a Republican, Democratic, right-left kind of conflict. By analogy, for example, with kratom, there are 7 states that have banned kratom. That includes Vermont, the most liberal state, perhaps, Alabama, perhaps the most conservative state. Other states that have prohibited are Rhode Island and Arkansas. When Massachusetts became the first state to increase the age from 18 to 21, it took a few years before Congress finally passed it. And that was a bipartisan vote to pass it in Congress a few years ago. And the legislation was signed by President Donald Trump in his first term. So this is not a Democratic Republican thing. And if any of your neighbors ask about that, you can point to reducing the impact on young people for addictive substances is not a partisan issue. Anyway, I'm glad to answer any questions. If you have a future hearing, we could bring some academic MDs and the like into it. I was in the town of Hardwick Thursday, and the chair of the board said he's a retired dentist, and he talked about what nicotine pouches do to the inside of people's mouths. I mean, it's just profound. So it's not just getting cancer and heart disease and emphysema, but it's all kinds of other bad things. Anyway, thanks a lot, and that's it in a nutshell.
Thank you, sir.
One question I had, Ken, is thank you for the overview, by the way. What was the process like in Belchertown in terms of, you know, informing the public that this is something the board is considering, and just the process of who was consulted and involved in the decision beyond the board, I guess?
Right. Well, every town kind of does it differently. I mean, Conway just sort of did it. The town of Conway they had a meeting of their board and they just passed it. I don't know if that was publicized at all, but I at least didn't know they were doing it until after I read about it in the Gazette. In Belchertown, we had a formal public hearing. The whole thing of hanging, posting a notice, a paid notice in the newspaper and the like. Our health director, Andrea Crete, went to each of our licensed dealers and told them that we were doing this. In other places, Conway would be one extreme, and in an intermediate would be not to have a formal public hearing, but to have a listening session, which they publicized. The town of Amherst had posted widely their hearing, and I can tell you a total of 4 people showed up to speak. I was one of them. The former chair of their Board of Health came. A retired doctor came, all speaking in favor of it, and some owner of a convenience store drove down from Maine to speak against it. Now, that's a community of 30,000 people, had 4 people show up, even though it was widely known. And I can tell you that the convenience stores sent out a mass mailing throughout the town, and that was the turnout. 4. Some UMass students came, and after they were asked, although they hadn't come to testify, they spoke in favor of nicotine-free generation. So you can have a formal public hearing, you can have a listening session, you can make a motion tonight and do it. I wouldn't recommend it. I think you'd probably get a lot of pushback on that. But and there are some decisions you're going to have to make. You're going to have to figure out, do you want to have the same penalties for selling to somebody over 21, but in violation of nicotine-free generation or not? You have to figure out what birth date you're going to pick, what implementation date you're going to pick. Both we and Amherst passed it, but said we were not going to implement it immediately. We give them, the community, some time to deal with it. So it would be technically on the books. Presumably, most of the merchants would follow it, but we wouldn't start giving penalties for a while. So there are a few questions like that which you'd have to think about in advance.
If I don't mind, if I just add to what Ken said, for the Board of Health, a public hearing is not legally required. I strongly recommend if you'd be interested in moving forward, that you would have a public hearing, and preferably an in-person public hearing. And I would be glad to notify in person all of the tobacco establishments, as well as provide them information to speak at the public hearing.
Which is what we did in Belchertown.
Great. Ryan, yeah, I would definitely agree a formal public in-person hearing. On a side note, would it be possible to get the study you were mentioning. And then also, can you send the board members a true copy of the legal pledge of legal help as well?
I can ask them for that, and I can certainly send you the link for the survey. It was co-authored by Dr. Winikoff, who I actually was on a Zoom meeting last night with. So sure.
Yeah, I would just like to add
by
that
all
up to the
means.
record.
It
Yeah.
probably should be part of the record.
Okay. I don't have anything else at this time regarding the tobacco-free. Ryan, were you going to talk about the bee regulation at all, or does Sam have anything else to add?
Nothing.
Yeah, I was
Sorry,
just
go
gonna
ahead.
add that I do think it's really important that there is, considerable discussion and public awareness and opportunities for the public to weigh in on this from the beginning. Having 3 people make a decision that impacts kind of the whole town is, I think, a pretty big responsibility, given that it can affect a lot of people. I am a little surprised that it's something that can be passed by the Board of Health and not by elected officials. That's just something I wasn't aware of, but yeah, I think an in-person public hearing would be good.
May I ask Ryan?
Yeah, and for the record too,
so
Sam,
we are elected in Belchtown. I don't know how that works here. Ryan?
Yeah, Easthampton were appointed.
Yeah,
operated by-
I'm aware of that. How are tobacco and other regulations set? Are they passed by the board alone, or do they have to go elsewhere?
Tobacco regulations go through the Board of Health. I think the reason that is it's a public health concern. The reason why I'm so passionate about tobacco and getting some type of updated regulations passed in the near future is just because our tobacco regulations haven't been updated since 2017. And then tobacco related deaths just remain the #1 cause of preventable deaths in the United States. And although, as the person said in the at the beginning of the meeting, although cigarette usage may be down, pouches as well as vaping is becoming a even more prevalent issue. And I just think that we're not limiting those who already use these products or preventing them who already use these products from using them. It's just for having the future generations who aren't yet using these products to not start using the products. I think that's the big misconception in regards to nicotine-free generation. We're not telling anyone who already does use nicotine products that they're no longer allowed to use nicotine products. It's just future generations who have yet to use nicotine products, if that makes it any clearer.
Ryan, my last question, I know we've been going back and forth about this. There's a couple advocacy groups for this. Pushing the updates. Are they just going like town to town, or how's this?
The pro tobacco groups, you mean?
Yeah, or the for the nicotine-free generation.
I mean, it's something recommended by the Mass Health Department organization.
Sure.
It's something recommended by our local tobacco alliance, just for all of the towns to be on the same page as far as regulations, making enforcement much easier.
Yeah. Okay. Yeah, I would definitely like to put this on, keep it on the agenda for next month. I would like best input on how to proceed.
Okay. We can readdress it next month. And then the only other thing I got in regards to ordinances is the non-owner occupied registration. I forwarded that to the board. I got it back yesterday from legal. They have some concerns in regards to whether it should be a Board of Health ordinance or a city regulation. So I just wanted to request we table that until I meet with the mayor and get his input, and then resubmit it to the legal team for review.
I'm okay with that.
Makes sense.
Do you need a formal motion for that, Ryan?
No, I don't need a formal motion. I just want to
No, okay, yeah.
keep you updated on where we currently stand with that, because I do think it is really important that we get those non-owner occupied properties to register so we have their information. But I want to make sure we're doing it the correct way.
How many units do we have? Do you know, or a rough estimate?
Absolutely no idea. I know how many short-term rentals
Wow.
we have, but no idea how many long-term rentals we have where the owner doesn't reside in the house.
Sure.
And then that's all I have for ordinance updates.
Nothing with the bees?
Nothing currently with the bees.
Oh, yeah. Okay. Sam, I don't have anything. It's pass it to you.
Yeah, no, I think that's it. Otherwise, it's just the items not reasonably anticipated by the chair 48 hours in advance. I don't know. Do you have anything?
Ryan, was there anything else?
Nothing.
I don't have anything. Okay.
Okay.
Well, thank you, everyone. I will make a motion to adjourn the Board of Health meeting at 6:40 p.m. on December 10th.
Motion seconded.
All in favor, Steve, yes.
Sam, yes.
Thank you
guys,
all.
meeting adjourned. Thank you very much.
This government meeting is brought to you by Eastworks and our local cable subscribers.